Hi, everyone. Welcome to the June Deaf Health Talk. So my name is Samantha Radhakonda. I work as a clinical research coordinator at MDisability and Family Medicine Department at the University of Michigan, and will be beginning medical school in the fall. Our moderator, Sarah, could not join us today, so I will be filling in. I identify as hard of hearing, but will be speaking today. Before I introduce our guests, let me tell you a little bit about the Deaf Health Talks. The Deaf Health Talks are held virtually each month and are a source for community health education for the deaf and hard of hearing members. Deaf Health Talks is hosted on Facebook Live and Zoom with accommodations. Each month, we cover many different health topics. So if you are interested in knowing what is going on, please sign up for the MailChimp. For the next hour, the Deaf Health Talks team will be posting links in the comments, such as the resource guides, research study on pregnancy, and newsletter sign up. Please feel free to put your questions in the comments or chats at any time. Now, thank you for joining us. I hope you are excited, and I want to introduce our presenters tonight and our experts on oral health. Joe Simona from University of Texas Health Center, San Antonio. Chris Lefelt from Elmwood Dental Group and Finger Lakes Community Health. And Michael Korleski from University of Michigan School of Dentistry. We are so glad to have them join us today and share their knowledge and answer your questions. I'm going to ask each of them now to briefly introduce themselves, and we will start with Joe.
Hi, everybody. My name is Dr. Joe Simona. I just graduated from the University of Michigan Dental School last year. I grew up in the Detroit area, and I'm about to finish my residency in San Antonio, Texas. So next month, actually, I'm moving back to Michigan.
How about Chris?
Hi, my name is Chris Lefelt, and I'm in Rochester, New York. I work at both Elmwood Group, which is a practice within the deaf community, 2 days a week, and then, well, full-time. And then I also work with a community center in about an hour outside of Rochester, New York. I graduated dental school a long time ago, 1987, from the University of Maryland. And I've had a lot of practice now, 34 years as a dentist.
And Michael.
Hi, everybody. My name is Michael Korleski. I grew up in Delaware. I graduated from Gallaudet University, and then I transferred to the University of Michigan. And so Joe and I actually were together just 3 years apart during school for a little bit. I'm now in my third year of school, and I'm working with my practicum with patients, and I'm really excited to really be hands-on in terms of interacting with the dentistry and deaf culture and making sure that ASL is present with our patients. And that way there's more benefits to be able to see ASL and deaf culture in the dentistry world. So I'm very, very excited about the possibilities and where I'm going to go from here.
Okay, thank you for introducing yourselves and joining us today. We are going to have each of them give a little bit, share about their experiences, their knowledge, and we will, hopefully you'll learn something or two, something. Why don't we start with Chris?
Sure. Okay, so if a new patient calls or texts to make an appointment with my office, which is the first time that I'm meeting this deaf client, communication is vital, that we have this face-to-face interaction and really develop a good rapport. That way the two of us get to know each other well, and then we will be able to, be on task with our business. Sometimes people don't know what's going on in terms of their oral health. So we really start very basic. We do questions a bit to ask about their knowledge. A lot of patients are really unaware of their oral health history or any exams that they may have had. So during that first sit down time, I usually dig into kind of a little bit of their past, but I'll do some measurements, and I might show them a little bit about what I'm going to do. Also, I'll show them some of my instruments as well. So my instruments or my tools, one of them is called a periodontal probe. And it's a very thin device that measures in millimeters. There are these black lines going down the probe. So if you think of this as the tooth, and where my shirt is the gum, I probe around the gum where it connects to the tooth. And with that, I measure that the first time I see those patients. So I use that probe to measure, and I give those numbers, and then we put them in their file, right? Which at this point is, just in the computer. And then a lot of patients are curious, what are those measurements? And so I'll go into detail to say that that probe will help me determine if there's any bleeding or if there's any abnormal things going on in terms of the gum line or any issues that I can notice. If you guys look in the chat, there's a picture. Are we able to share that picture right now?
It has been shared.
Okay, great. So that first picture in that link is we use a special dye. We'll swish this pink liquid around, and what that does is it leaves areas of their teeth pink. Patients often get very concerned about this discoloration, and so I'll explain to them that what that does is the pink coloring sticks to the plaque on their teeth. And I'll just say that this is a normal everyday occurrence that gets on your teeth because of what you eat. And the best way to address this is by brushing. But where they don't get with brushing, and they miss sometimes because they don't floss, get stuck on their teeth. And so this is really important when we have patients, is that they get to see the importance of flossing as well as brushing. So when you see you rarely see someone's teeth without any pink at all. But for whatever reason, you might see, again, in the third picture from that link that you guys sent, which is an inflamed gum. You'll see that the gums are red, and there's plaque buildup around there. And what happens in that area is that bacteria starts to grow. In the fourth picture in that link you sent, you see all that the interesting shape. That's under a magnifying glass, right? We've taken an image and blown it up, and you can see the bacteria living inside the biofilm or inside the plaque. So they get, so when you just eat on a regular basis in meals, that food sticks on the teeth, and the bacteria use that food in order to grow and to multiply. And if they're not dealt with, then it becomes a hard calculus. So if we move on to the next one, the last picture, you can see that white buildup has grown. And so that dye is showing us how thick it is. and that starts to irritate the gums. Okay. So I help them identify, and in my exam, figure out if there's any disease present, any decay, how the bone is doing. We measure the gums. 2 to 3 millimeters is, and there's no bleeding, I would consider a healthy gum. If it's deeper, if the gum reception is deeper than that, 3, 4, 5 millimeter, we might start to get concerned. Or if the gums are inflamed, that could be in presence of infection, there's bleeding or pain. If any of the teeth are loose, we go ahead and address that. We try to calm our patients' concerns. And what we do is we walk them through every step of the process so they really understand what's going on. And we're able to talk about the importance of brushing every day, going to the dentist, sometimes not every 6 months, but every 4 months if things are going on. We really develop a catered treatment plan to address any periodontal disease or gum disease, as well as our cleaning treatments. And what we do also is x-rays. And what we'll do is we'll do Novocaine, and for any areas if we need to get in there, we'll work on a quarter of the mouth at a time with any of the gum problems. The second appointment, we might work on the sort of the other side of the top set of teeth, because we've done a deep cleaning on the top left, but we work quarter by quarter, so we'll work on the top right. And it really doesn't take that long. It takes about an hour. But if you've not been to the dentist in 3, 4, 5 years, is when we start to really do this in-depth process of cleaning in sections as opposed to your whole mouth at one time. And if you're really concerned about the pain, I make it my top priority to make sure my patients are comfortable. And at any point during treatment, they can ask the hygienist, the hygienist to stop because they're having some pain, and we might put some numbing medication on it. Or as the dentist, I might come in and again do a little bit of numbing injection. And I'm not always seeing patients on a 3-month basis. Sometimes it could be as long as 6 months in between. Because if there's no plaque, no tartar buildup, the gums look healthy, they're not in pain, none of the teeth are loose, they're not having any of these oral health issues, then it's not really that complicated. Or sometimes when their first appointment, I want to make sure that our patients really understand what their treatment will be and to really get them involved.
Chris, you finished with your presentation? Okay, we will move on to Michael. How about you share some information?
Yeah, absolutely. Thanks, Chris, for your excellent explanation about periodontal disease. Okay, so I'm going to talk about cavities, dental decay, tooth decay. Some of you may or may not know what that is. So let's take a deep dive. Cavities come from bacteria, and how much of your pH, as a measurement we take of your mouth, your pH level, to see whether your teeth are beginning to break down or not. Bacteria will feed off of the food that you eat. But before I go into that, let me back up. There are different types of categories. And we'll do different treatment plans depending on the type of cavity you have. So if you have healthy teeth, we call it sound teeth, right? Very much a hearing word. And what we'll do is we'll do an explorer, which is something that we'll do to really dig into a cavity. cavity. And so what that did is that explorer will make a really strong sound for the dentist. And so that's why you have sound teeth if you pass that test. The other thing is we have where like a hygienist will take x-rays of different portions of your mouth. Typically there are 4 to look at each section. And between where 2 teeth are called interproximal. And that's where we have a difficult time seeing what's going on between the teeth. And so lots of stuff can hide in between in that interproximal area. And that's where your teeth are often touching each other. So we're able to not really see those as a dentist just with a visual look, so we have to look through an x-ray. And then we'll also do a double check with our probes to be able to confirm what we see on the x-ray. So that aside, during the exam, we'll use our variety of tools. Depending on what we see, are your teeth softer? Are there any abnormalities? We'll pick the right tool based on what we see. When we find a cavity, there are lots of different approaches for treatment and care. So if it's just a tiny little spot, just the littlest point of decay, we might just go ahead and drill around it and dig around it and get it out. Especially if it's in the outside of the tooth, because understand the tooth has 3 different structures. There's the enamel, which is the outermost coating, and that's the strongest part of the tooth. Then the next inside part, the layer is called the dentin layer. It's weaker than the enamel, but it's still rather hardy. And then we have the pulp, which is the innermost part. And we have to determine how far the cavity has gone through those layers. If it's gone all the way to the pulp, really the tooth is going to need to be pulled because it's going to get quite serious at that point. But if a cavity is really just in the enamel portion of the outside, we might determine that it's just going to be something that we watch. And that's the most conservative approach. And we might just do like a fluoride treatment, which is something that we paint over that area. And then if it's a little bit bigger of a cavity, we might put a sealant on it, and that stops the bacteria from continuing to feed and grow in that cavity because there's no hole left for them to be in. So the bacteria that's in there dies, which halts the progression of the cavity. And if it gets all the way through the dentin, that's when a dentist might say, okay, we need to go ahead and address it now, because once it's gone through the dentin, there's really no going back. That cavity is there. So we're going to have to drill in and cap it off. And now all dentists use a white filling. Maybe in a special situation, like a hospital or something, there might still be a silver filling, but that's not very common anymore. Really, the white filling is what they use to cap and seal it. And that gets the cavity out. However, if you decide, or if it's not treated and that cavity continues to decay and it digs all the way down to the pulp, that's when a patient is going to start to really feel sensitive from that tooth, and that's going to cause a lot of pain. And at that point, there are 2 options. Either there's a root canal, where there's a drilling all the way down to the pulp, and they dig out all of the bacteria-ridden area, and they try to save the tooth. And what that does is it really prevents infection, which can be caused by the bacteria just living in there. Or they'll put on a crown. So there are lots of different approaches to dealing with cavities. It's important to know exactly what's going on with your teeth. Keep them as healthy as possible. gum health as well is a really important thing to keep up on. So 6 months your appointment should be about 6 months apart for cleaning. And then the dentist also comes in and double checks what the hygienist has done and just looks over your teeth and makes sure that the shape and everything looks good. That way nothing gets missed and stays undetected, and your teeth are nice and clean and happy. So that's my portion. Thank you very much.
Thank you. So far, we have heard about gingival health from Chris, and Michael has explained the structure of the tooth and shared details on cavities. So thank you both for that helpful information. And let's move on to our third and final presenter, Joe.
Hi, thanks Mike and Chris very much for going into cavities and for gum health. I wanted to talk about our body and how that's connected to our oral health. Smoking, alcohol, diabetes, what you eat, all of these relate to our physical health as well as our oral health. I mean, alcohol is something we drink to enjoy, but a lot of that can have continued influence, impact on our body. So when we eat and drink this, our mouth creates saliva when it's dry, and that can really lead to oral decay. And it makes our gums, hurts our gums as well. The other thing is diet is a big risk factor. It's important to control how much sugar we eat, because that can really lead to accelerated gum decay and cavities as well. So we want to control our sugars, and that leads to better gum health. If you have diabetes and your diabetes is well controlled and you're having better sugars, that plaque that Chris was talking about is where that bacteria can live, and that sugars will feed the bacteria. So a fun fact about half the people with periodontitis were smokers. People who smoke are 4 times more likely to get gum disease than non-smokers. Where that plaque is builds up even faster if you're a smoker. So smoking changes our body's response to things. Our body becomes more active, and it takes a longer time for our mouths to heal if something goes wrong. And smokers also have a more difficult time responding to gum treatment. So that's why it's important to really keep on oral health. Brush twice a day, morning and evening, before bed. And it's also important to brush with a fluoride toothpaste, because fluoride has minerals inside of it, and that mineral helps to strengthen the tooth, which prevents against tooth decay. Most people have a hard time brushing certain areas of their mouth. For example, like Michael was saying, in between teeth. Or if you're right-handed, they'll sometimes have a difficult time getting to the back right area of their mouth. And people also think that you have to brush aggressively to make sure it's nice and clean. But brushing aggressively can actually damage your teeth and reduce your enamel layer. So it's better to brush with a little bit more sensitivity. So let me talk about the best way to brush and some of the technology. So you want to brush at a 45-degree angle to the tooth. And you want to brush in circular motions. You want to get all 3 sides of the tooth, top, back, and front. A lot of people tend to ask, what about an electric toothbrush versus a manual toothbrush? And really, they're about the same. People think that an electric toothbrush is better, but really it's preference. An electric toothbrush is good for people who have limited motor control. That might be a good tool for them. And that's yeah, that was what I planned to share. Chris was saying, can I add something? Yeah, Chris? Okay, yeah, I just wanted to add. First, thanks, Joe and Michael, both of you, for your presentations. As a patient, if you've newly been diagnosed with diabetes, a lot of people are concerned and they're confused why a doctor would say, how is your oral health? Or how is your foot health? From a dentist perspective, speaking of like gum bleeding, what happens is as you start to bleed, things can get stuck in those capillaries. So capillaries are the thinnest blood vessels all over your body. And you have them in your gums as well as in your feet. And so as we're like a podiatrist, a foot doctor will go through and feel all the different areas of your feet to make sure that there's no numbness, there's no swelling, you still have sensation, that there's no pain. The same type of assessment is happening with your gums and that kind of pain. It's really important to come to the dentist regularly for screening. That way we can keep on any measurements and exams that we need to do to see how your oral health is going. To control your sugars, make sure that your A1C stays around 7 and that your sugar levels stay low. Because once you start to get into those higher numbers and your diabetes is really out of control, it's really bad for your health in general. I mean, as a dentist, I know that I'm focused mostly on oral health, but once we get to diabetes, it's important to really make sure that that's a strong component in your overall health, because bone loss is something that is very hard to detect. And so if your diabetes goes unchecked and it leads to this bone loss, gum loss, bleeding, eventually your teeth become loose because your gums will create this pocket and you wouldn't be able to enjoy food the same way when your teeth start to fall out. So keeping your sugars under control is very important as somebody who's a diagnosed diabetic. So at the beginning of that diagnosis, I really encourage people, doctors will say, lose weight, keep on your medication regimen, see certain specialists, but especially come to the dentist. That way we keep on your oral health as well. That was something I wanted to add to what Joseph was saying about diabetes. But that was, I can't remember what I want to say. Thanks, Chris. The other thing that I wanted to mention about the best brushing is the fluoride. You want to make sure to spit it out. Don't swallow that toothpaste. That fluoride needs to come out of your mouth. And Michael was saying, many people, I think, are just so used to spitting. Because what happens when you brush, there's that foaming. So it's really important for us to, don't swish afterward though. Spit the toothpaste out, but then don't rinse, because you want to leave the fluoride from the toothpaste on the tooth. So rinsing after brushing can be fine as long as the rinse has fluoride in it, because you don't want to wipe the fluoride off with the swishing after you've brushed.
Okay. Okay, everyone, we are going to, well, first off, thank you so much. That was a great, helpful information and such different topics from each three of you. we're going to go ahead and allow the audience to ask their questions. So for those of you who are watching, feel free to put your questions in the Facebook comments or in the Zoom chat, and we will see if we can get to answer some of them for you. And while we're waiting for your questions, why don't we go ahead and just start off with a question for you, Joe. So you had mentioned some of the risk factors and you talked about diabetes, which Chris had added on to as well. Can you maybe share some of the most helpful preventative measures and diet suggestions that will reduce the risk for poor oral health?
Yeah, I mean, I definitely could suggest, reduce your number of sugary beverages. Don't have big meals. It's better to eat small meals as a diabetic because that gives your saliva time to clean out the mouth after the meal. And if you are going to drink a sugary drink, just drink it. Don't sip on it all day. Because again, you want that saliva in your mouth to have a chance to clean it out. But if you sip all day, that sugar is just going to sit in your mouth and the saliva doesn't have a chance to clean it off of your teeth. So if you are going to have a sugary drink, just drink it all in one sitting. That's what I would say about that. And then in terms of reduce how often you have carbs. And if you find that you're really a big pop and coffee drinker, rather than just saying stop, maybe switch to diet pop or do a sweetener instead of sugar in your coffee. Or if you can, if you do drink a full sugared pop, swish with some water afterwards to rinse it out. Chris, though, did you want to add something? Yeah. We were surprised that the research, like there's a creamer that goes in coffee has a lot of sugar. And if you compare that to just putting in, if we compared milk and creamer and half and flavored cream and all the different things that you can put in your coffee, the sugars in those creamers is really high. And if you're having 3 or 4 cups of coffee a day, every day of the week, that's going to be really detrimental. So our job is just education, right? We look at the facts, the nutrition labels of the food, the first 3 or 4 items on there, you're going to, of the ingredients label, you might see high fructose corn syrup. That's just sugar. That's what it is. High fructose corn syrup is just sugar. We think, well, that doesn't say sugar, but it is sugar. That's what I'm telling you. It's a kind of sugar. So really try to keep that in mind. Fix it, that it can be, I don't know, whatever, it's more expensive or that there are aspects of your life you value more. But yes, like you're saying, diet. Well, and if you use a straw, pop also touches fewer teeth. And then also drinking it at the same time as a meal, as opposed to, like you said, continuing to sip on a drink all day. For example, kids' juice boxes where they just sip all day is just such a terrible thing. It's just better to give kids water. Really, water is the best drink. I mean, have coffee. I'm not trying to say that, but just substitute. Even if you don't like the taste of sweeteners, try different brands. There's stevia, there's Sweet and Low. I mean, there's the blue packet. You might find one that you like. I mean, it's not healthy. There's still sugar in there, but even if you were to reduce your, how much sugar you put in there, it's still sugar. And I drink it myself. So if you can do, put water with fruit in it, or iced tea. I mean, just try to expand your beverage choices to avoid as much sugar as possible. Geez, I can't think of anything. Michael, is there something you want to add? Yeah, Chris, thank you so much for adding all of those points. I think one of the things people struggle with is in terms of quitting pop. And I was thinking of at least how to help reduce people. And maybe it's like a slow transition. So the first week, try to cut the number of pops you have by mixing it with water. And then continue to adjust the ratio of mixing water and pop together in the same glass, where you eventually have more and more water in that glass, where you slowly take that pop away. So we're avoiding quitting cold turkey and for your body to have that craving. And also, another recommendation, it's important to, well, going back to what I was saying, pop is very acidic, and acidic environments are very bad for your teeth. So if you're using a straw, that straw will help it go straight to the back of your throat. And so that way the pop doesn't come in contact with your teeth so much. So again, that's another thing that I share with my patients regularly.
Thank you all for your input. Michael, you had mentioned earlier about dental checkups. Can you expand and explain how often adults should get a dental checkup and children as well?
Yeah, I'm happy to answer that question. The answer is the same for both adults and children. But children need to go as often as adults because cavities and tooth decay can show up in both adults and children. Adults are more high risk of cavities because of their behavior, their motivation to teeth their, and for children, the risk of cavities is greater because their motivation to clean their teeth is a little bit less. And so, but you don't have to come more often, because unless they have a bad diet, they eat a lot of sugar, they drink a lot of sugary drinks like we've talked about, that's going to lead to a higher risk of tooth decay. But in terms of the number of times you should come to see the dentist, it's about the same for children and adults, unless you have any health concerns. What will happen is, as a child's baby teeth come in, they're going to be replaced by adult teeth. They're going to push those baby teeth out, and those adult teeth are going to be stronger, and they're also going to, once those come in, make an appointment every 6 months to make sure you keep the cleaning regimen. That way you're able to catch any decay when it happens and address it right away. Joe, did you want to add something? Yeah, I did. Most of the time, patients don't show up in the office until it's an emergency, right? So they show up when they are having pain. What's important is to see the dentist regularly every 6 months so that you don't ever get to a point where you have tooth pain, right? Don't ignore your teeth until there's an emergency. If you come every 6 months, you're actually going to save money in the long run by doing preventative care and maintenance. And we're able to fix something when we catch it when it's small, as opposed to it leading to something as big as a root canal, which is very expensive. So it's better to go to the doctor regularly every 6 months for that checkup to take care of your teeth. Joe, Michael, very good advice. When we've got, and another thing is, people will ask, when should they start bringing their kids in? And I would say 1 year old. Because if there's no fluoride in the water of your home, for example, people who have well water don't have fluoride. The risk of cavities goes up in those. Brushing twice a day with fluoride toothpaste is definitely supplemental, but we'll also use, it's like a paint. We'll actually paint fluoride on to the teeth to give kids better protection in between those appointments for those 6 months. And insurance is often happy to pay for those fluoride treatments. Insurance companies recognize it's actually cheaper to pay for preventative care than to pay for a surgery or an extraction, and we don't want your kids to miss school because of tooth pain or have where they can't chew or eat properly. So keep those appointments up for kids. And if we've identified that they're at a higher risk, we'll go ahead and do that fluoride treatment. So it's a pediatrician. Some states allow your pediatrician to actually do fluoride treatments in their office. And it's the same kind of preventative measure as giving all the vaccines that a child is scheduled to get. And another thought I had was, if you're not sure in terms of flossing or brushing, or if you have the right technology for you, when you go to your dentist for a cleaning, right, or the hygienist who's cleaning your teeth, ask them about what you're using at home to clean your teeth and see if they have any recommendations to do something better. They will teach you. They might show you where you're doing something wrong, and they can give you a better technique as well. And they might talk about some tools you have. There are floss holders. Like, it's interesting. You would tie the floss around these two plastic picks, and then you use that holder to go in between your teeth. Or there are these green flexible sticks that you can poke right through your teeth, or right through the gaps in your teeth. And, there are lots of different dental tools that your hygienist can recommend. So don't be embarrassed. Speak up, because it's your money, it's your oral health, and ask the hygienist how you can do it better to take care of your teeth at home.
Chris, we have a question related to what you just spoke about. So someone from the audience is asking, how do we prevent and avoid plaque? And if you have gum disease, is it important to use the water tooth floss, water pick?
Oh, you know what? The best is still this, for all of our deaf community, we're very good with our hands, right? We know our signs. You all should be phenomenal flossers. In terms of the water pick, it's that high pressure water spray. It's like the same machine that you use to spray your house down. You get under the eaves, right, with that water pressure system. But don't use that in place of flossing. Okay, it's just as successful as swishing water around in your mouth, to be honest. Physically removing the bacteria and plaque every day, which develops within 24 hours, because every 24 hours that plaque creating bacteria grows again. So brushing twice a day is important. Flossing is important. And getting in between those teeth. So you want to be able to get both sides of the gaps in between your teeth. And again, talk to your hygienist, have them teach you and show you the best way. Yes, excellent, Chris. Good comments.
Okay. So earlier, Joe, you had mentioned and recommended not aggressively brushing. We have a question about any preference on a toothbrush, toothpaste, and how often should we replace toothbrushes?
It's important to have a soft bristle toothbrush. It's the easiest on your teeth. and it's not as aggressive when you go in there. And in terms of toothpaste, they're all really the same. It's just important to make sure that it has fluoride as an ingredient. And if you have sensitive teeth, you may want to go ahead and try Sensodyne. That helps reduce sensitivity. So that's an option. But as long as your toothpaste has fluoride, that's going to help make your teeth stronger. This is Chris. Can I add something? People think they need to clean their mouth, their teeth, like they clean the bathroom floor and really get in there and scrub. And actually, you want to be gentle. Think of it like a butterfly wing, right? You want to just get on the surface of the teeth. And you want to replace your toothbrush every 3 months. So when you go to buy that new toothbrush, make sure it says soft on the package. If you've got something harder than that, throw it out. Because after 3 months, that soft bristle toothbrush is going to start to wear out and you want to replace it. What happens when those bristles splay out is they don't get where they need to go, and they can start irritating your gums. Or what's even worse is they can sometimes get down to the root in between the gum and the teeth, and they can start to scratch. So once you start to see those toothbrush bristles splay, go ahead and replace them, and think brush softly. Don't get in there and scrub like you scrub the bathroom floor, okay? Again, your hygienist will show you exactly how to do it. And this is Joe. I always say, think of it like a massage, right? You wouldn't want an aggressive massage. And this is Michael. You know, Chris, Joe, your comments are great, but I did want to add one thing. The soft bristle toothbrush is important, but another thing I find very important is how long after you eat before you brush. Because food, as it stays there, really starts to eat away at your enamel. So to keep your teeth nice and strong, you need to be able to get in there and brush quickly. Food staying in your mouth also creates a more acidic environment in your mouth. And what happens is by brushing, you're able to get your mouth back to that baseline, and your saliva can start to work on that enamel again. So when you eat, brush as soon as you can and dig away some of that food that's going to get stuck in your gums or in between your teeth. But you want to wait about a half of an hour after eating. That way your saliva is able to get in there and raise the pH level again of your mouth. So wait a little bit, wait about a half of an hour, and then go ahead and brush after eating.
Okay, so we have a question. I'm going to address it to Michael. So recently, the Dental Association took daily flossing out of their routine recommendation. So should we continue to floss or don't need to floss as much?
Well, my answer is you still have to floss every day. Flossing is so important because brushing and swishing are powerful. Whether you use electric toothbrush or a manual toothbrush, it doesn't matter. But flossing will catch about 30% of what you've missed with your brushing, because a toothbrush can't reach every area. And even brushing twice a day, you will still want to floss after you brush. And that, just think of it as a nice ending to your brushing routine. So floss twice a day.
Thank you.
Yep. Guys, do you want to add anything else? Chris, Joe? No?
So the next question from our audience is, Either Chris, maybe I'll address it to you. Many young families struggle to find dental care for even their 2 to 3-year-olds. Do you or anybody else have any thoughts about the fluoride varnish to bridge that until they're able to secure a dentist long-term?
Every family situation is different. It really depends on what your family situation is. And then really, I can only address what I see in the state of New York. I know that that's covered by insurance. Doesn't matter what your income is. I think it's up to the age of 18. And some insurance plans will even cover it up to age 21. And if you're under your parents' insurance plan, even as long as up to the age of 26. So many pediatricians, or family practice physicians have knowledge about where these resources are. So have a family, if you don't have dental insurance or you can't cover that, then I would suggest reaching out to like maybe your government association to see if there's like a medical plan that you could probably get on. So some insurances have like a coordinating, like a specialist. You could reach out to a social worker, kind of like or even like your family doctor. Just somebody who, and maybe if it's under where you work, maybe even reaching out to HR, just figuring out some way to get it under your medical plan. And I know that that's not going to be the answer for every state. Since Obamacare was enacted, it's really been great for our state. People who are covered, who have not been able to afford treatment, and they're able to come in, and now they're able to get preventative care. And it really has reduced the number of cavities. It reduces the number of days that kids miss school because of oral health issues. So, I just reach out to your family doctor, and if they can do a fluoride treatment in a regular appointment, go ahead and do that. And then just kind of investigating what your insurance can do, whether or not if you have insurance to work, reaching out to your HR department or the county health department. If you reach out to them and talk about ways to cover your child's oral health, they should have resources for you. I hope that helps in answering that question.
Okay, so our next question, I'm going to address it to Joe. Someone had asked that they noticed that people over the age of 40 tend to have brown or darker color staining on the teeth. Could you maybe explain why that is the case? And because you talked about prevention, maybe any suggestions for that?
Well, the brown coloring is years and years of staining since they were a kid, drinking coffee, drinking tea, drinking wine, dark color, all of that coloring stains the teeth and it will eventually become darker. So there are a few ways to address that. Again, regular cleaning every 6 months. You could also do whitening strips. That can help address the staining. I don't know, guys, anything else you want to add? This is Chris. Joe, I just want to add to what you said. The best way to get the whitest teeth really depends on your comfort level, so to speak. How much you want to do. If you really want your teeth sparkling white, sure. You don't want cavities is more important. You don't want gum disease. But ask your dental hygienist for recommendations. They might do a whitening strip. There's also a whitening rinse. I would say that they do 50 to 60%. They address 50 to 60% of the staining. Because again, it's red wine, coffee, a lot of those dark drinks. If you continue to drink them, your teeth are just going to get stained again. There's another thing that they do where you sit in an office chair, right? And they'll do a UV light treatment for an hour. And your teeth can be sparkling white after that. Or if that's too expensive and you don't have that time, there's at-home application whitening strips. American Dental Health Association. Please don't order the ones online when you're just looking around at 3 or 4 o'clock in the morning. Find a well-respected, trustworthy organization that has a strip with approval and then you would use those every day. And people think that the longer you leave them on, that the whiter you're gonna get, but all of that stuff dissolves after a certain amount of time. There is also these trays that have things that you have the whitening stuff that you put in there and then put on your teeth. I think you leave them on for, I think it's every day for about a week. I don't know if it's about 45 minutes or so, but I think it's like a peroxide. You'll feel this bubbling when you put it. So that's also another tool for teeth whitening.
Okay, so we are nearing the end of the hour. I don't think we can answer any more questions, even though thank you so much for everyone for asking your questions. And before we end, I want to quickly allow the presenters to just give some last words, last advice, anything that they want to share before I wrap up the talk. Why don't we start with Michael? You have any last words to share with the audience?
Well, yeah, I think just to repeat what we've said, go to your dentist every 6 months, brush twice a day, floss regularly. It's very important. I mean, that's really what you do to keep your teeth healthy and strong.
And Joe, you any last words?
Yeah, really, I want to say the same thing as Michael. Brush twice a day, morning and evening. And then there are some other resources that I have to share with you. I made a YouTube video that you can find online about oral health. And I've got lots of pictures in that video. It's all done in ASL. And that will really help you understand clearly what's going on to be able to take care of your teeth.
And lastly, Chris.
Okay. A good, well-respected website for oral health is mouthhealth.org. They have got an abundance of resources and links, both in English and in Spanish, which is excellent. But feel free to email me with other questions. I mean, if you have specific things about your own health, I can't give you a recommendation because I'm not your dentist and I'm not seeing you. You'll want to go to your dentist with all of your questions because it's your teeth, it's your life, it's your money. Your dentists are happy to share their experience with you and work with you to keep your teeth healthy and strong for a lifetime.
Okay, I want to give a few quick thank yous before we wrap up. Thank you for your last words. Huge thank you to our presenters tonight, Joe, Chris, and Michael. Thank you for sharing so much of your own personal knowledge and answering everyone's questions. Thank you to Kate Miller for the cart services. And our interpreter, James Check. And lastly, I want to thank everyone who was involved in helping put together this event, including our Deaf Health Talks team, Kayla Helm, Dr. Michael McKee, Noah Kim, Sarah Hein, Pavani Chilukuri, and Sanjana Radhakanda. Thank you all for attending tonight. Next month, there will be no Deaf Health Talk, but the next talk will be on August 24th at 8 p.m. Eastern Daylight Time. Hope to see you then and enjoy your night.
Thank you, everybody.